So we are on live, right?
Yeah.
Hey, and welcome to the Matt and Pat Show. And tonight we will be talking about. So we are on. Let's start again. Hey, what's going on? We're Matt and Pat, and we are talking about regenerative medicine tonight. Wait, did I say your name first? It should be the Pat and Matt Show, but you know what? We'll give it up for my cousin Matt, who's on from D.C. area, Maryland. Where are you living anyway, Matt? I don't even know where my cousin's living.
Is that needed?
I live in the suburbs.
You look like it.
Yeah.
Yeah, so we're talking regenerative medicine, science, and all that good stuff.
Yeah.
And what we are trying to do is line up our next show. So we want to find out what you want us to talk about, because we're going to get some really great scientists. And Matt, tell them about what we are going to do.
Yeah, so this is something that Patrick and I were talking about for quite some time. We started by investing in Organovo, and that's been over the last couple of years. And what we did is that actually got us to reach out and understand more. And there's a field called regenerative medicine that takes various techniques to increase longevity or actually repair the body from the inside. So after doing some research, Pat and I realized it's like regenerative medicine includes essentially, in our opinion, but we're going to get some expert help, is cell-based therapy. Everybody's heard about stem cell therapy. Well, I want to know more about that. What's going on? And I see a lot of posts on LinkedIn and stuff, and I want to know what the latest is in stem cell therapy.
So we're looking
Then
for the
there's
latest,
CRISPR.
greatest, Matty. Whoa.
Yeah.
So we are looking for the latest, greatest, and I just want to give some shout outs to some of the people that are in and listening. We got some feedback issues. We got a little technical problems here. We got Mariana Watton, my old roommate. What's going on, Mariana? We got Peter Collins, a hockey man, a restaurant club owner. We got Goran, what's up, which is an Airbnb guest. We have Susan Esposito Stern, a fashion maven living out in Colorado, a college friend of mine. We got Gain Green up in Harlem making moves all times. We got Jennifer Woben, Fitch. She got married to the Fitch man. She's also from high school. We also got Scott P. Mervin on the line. And I know Scott, I've seen some stuff that Scott's been posting. So, yeah, he's into this future of science and longevity and regenerative medicine. So, Matt, continue with your talk. We're just. So, what we're doing is we're lining up our next show. We got some really amazing scientists. We're still trying to get everybody together, everybody coordinated for a certain time that we could lead this talk. But what we wanted to do is go out to you guys and figure out what you might want to, zero in on, because.
Well, I was just talking. You kind of interrupted.
I was just trying to give this. I was trying to give the shout outs. Neil Tomachuk, another. I don't see no Cranberry people, no Yardley people coming in here. You see the representing. Come on. Go ahead.
Listen,
my cousin Matt. Go ahead.
So the first thing was, listen, you've even heard of it, right? Stem cell therapy. You've heard of that, right?
Yes, I have.
All right. So everybody's heard a little bit of something about it. We want to know more. Then the next is
Look, this is gonna be like MTV Raps a little bit. You gotta I got people coming in, and I'm gonna. So you just talk through me. You talk through me, and I'm going to let you. Yeah. So let's go. See, work it out. Gonna work out.
All right. I'll give you. How about this? I say something, then I'll give you a pause, and you can give shout outs, and then then I can say something. All right.
Perfect. You guys like that?
Okay. Great. Okay. So the second thing is CRISPR-Cas9. Have you heard anything about that, Pat?
I know about CRISPR-Cas9. Yes, I do, Matt. We got Stephen Kofer on the line. He's a judo master from right around the corner. Go ahead, nice. Stephen. All right. Maybe it's a little too much. I'm gonna tone the shout outs down, but I do want to recognize. Go ahead, Matty.
It's cool. So then the next and the last thing that I see is bioprinting, and that's what we did our last two shows on, was like organovo and the ability to build tissues and repair tissues and stuff like that. So again, cell therapy, CRISPR-Cas9, and bioprinting. So Pat, you told me you knew about CRISPR-Cas9. What do you know about it?
Well, CRISPR-Cas9, it's very, very
It's not a
rudimentary
cereal. I
knowledge.
want you to know.
No, well, what are you talking about? You putting words in my mouth? So
I'm
what
just
I know
saying.
about CRISPR-Cas9 is it's the ability to go in and along the the genetic code, they're able to manipulate that, and they feel like they're able to potentially ward off certain kinds of diseases. I know they're working on some eye situations. But Kim Baldus, what's going on? Robin Hendrickson. It's all Walsh's people. I got another college gamecock up here. We got Robin Hendrickson. She's a
Well,
beautiful farmer. I don't know if
isn't
she's
this
still
your
got that
feed?
farm, man, but she's still looking beautiful. What's that?
Isn't this your feed? Of course they're your people.
Well, maybe it's time for you to start a network where you bringing in all my crew. Derek Hersey, he's a casting agent extraordinaire. Derek, I heard you're like international. What's going on? So yeah, I do know a little bit about CRISPR-Cas9. My friendly nephew. I meant
You
my
do?
nephew, my cousin. You're way too old to be a nephew. Okay, so go ahead. Keep going. So
Yeah.
what can you tell me about CRISPR-Cas9? And also, has
Well,
anybody else heard about CRISPR-Cas9?
yeah, ask everybody if they heard it. If they've even
Because we're
heard
going to do the
anything.
show. And also, if anybody wants me to give them the link to join our little podcast, and
Yes.
you'll be on screen, you are welcome to do that. How about that? Kaja, another
Come on
stunt
in.
girl, awesome. Mac Tavares, go ahead. Just give us some shout outs.
So did
I don't want
anybody
to ruin the
say that?
flow. You go back. You go back to Cas9. Go ahead. Tell us what it's about.
Okay. Did anybody say that they knew anything about CRISPR-Cas9? Or heard of it? Heard of it at all?
Has anybody heard of CRISPR-Cas9? Richard Paff, Drew Paff's brother. You might have met him down the beach, um, Matt. Anybody know about regenerative medicine or CRISPR-Cas9? Nobody yet. Why don't you
That's
continue to tell
that's
us?
great.
Good.
Because
Okay.
listen, this is the stuff of the like now future. If you look up CRISPR-Cas9, now Pat, pull it up, pull up the latest article because there is recently was a study that was done. So what CRISPR-Cas9 is, and you can Google CRISPR-Cas9 and just pull up the most recent article and put it on here. But what they did was it's an enzyme that goes and it attaches right to the DNA strand and it can snip out a, a, a genome right out of the double helix. It goes and it attaches to the double helix of the DNA inside of cells and it can edit it. It takes out the bad one and it can put in a new one. So the thought is that this is the type of stuff that can end Hodgkin's disease, lymphoma. You've got
Alzheimer's.
syndrome. Well, Alzheimer's, I mean, that you're into a genetic thing. I don't know if that's acquired later or if that's in your genes from the beginning, but that's the type of conversation where you can stop sickle cell anemia, Parkinson's disease. So the promise is there. And pull up that article again. What did it say? Because there was a study recently, and let's just look at this for a second. You put it up there so fast, you can't even read it.
Okay.
All right, read it. You got your glasses?
I got my
All
glasses
right.
on. All right, from the top, gene editing companies hit back at paper that criticize CRISPR. Okay,
Yeah, what
should I
this is
paraphrase this or should I go through it? Do you want me to read the whole article? Because I've
no,
read it
no,
before, so I
stop.
know.
I know what this is. I know what this
Okay.
is. What this is that there was a study that was sent out to Nature. There was a study that was incorrectly set up. It's almost like when somebody does like a bashing of something like a stock or something like that. Well,
Yeah.
these people put out a study saying that the CRISPR-Cas9 technology had formed mutations in mice, but the
Right.
reality is that there's a bunch of scientists that are jumping back and saying the study was not designed right. They made some errors in it. They said that some of the things were mislabeled. So it was kind of a funky study. And they're really kind of pissed off that it got out, like all these people pumped it, that it was, it's bad. So
Right. And the crazy thing about it is these companies that were really on the cusp of, figuring a lot of good stuff out, their companies tanked. They tanked because these losers put out something like. That's the problem, man. Everybody's always trying to get up in something that they don't even know. Let the scientists let them be innovative, man. Let them stop all this control stuff. Everybody's always trying to control the conversation. We need this, we need that for this or that, whatever.
Yeah.
Let these guys stay off them and let them do some amazing things. It's about time this country gets back into innovation.
All right, you're running for
Why
office?
are we not flying? Why are we not flying around in cars right now? Are you kidding me? Huh? Why are we still using gas? That's for another conversation. But we are talking
a different
next generation
you're
science.
kind of riffing.
We're talking CRISPR,
All right,
Cas9. Continue, Matty.
Do me a favor, pull up CRISPR, just Wikipedia CRISPR-Cas9, because that'll tell everybody what it really is, and we can kind of get out there. Just Wikipedia that. Whoa. That's a funky screen.
Hold on. We got some technical issues here. Okay, I'm gonna do that. Oh, bingo. What, you want to hear CRISPR?
Wikipedia, yeah, or do CRISPR, no E, CRISPR.
I got it right there. Don't worry.
All right, let's see.
Is it moving ahead too quickly? You want the Wikipedia page? What do you want?
Yeah, just like the definition of CRISPR. Go ahead, go to the.
I got it. We're going Wiki.
Oh, you're going scholarly article. There you go, Wiki.
Okay.
So
should I read it? Should I read it here? Clustered
I don't
regularly.
know.
Clustered regularly, interspaced, short, palindromic repeats. What is that? I mean, come on. That's a little bit. That's too scientific right there. That's why we need the big players up in here.
Listen, they play a key role in bacteria to form the base. Basically, what it is, it's an enzyme that attaches. Look at the strands. Look at like the chart. They throw it in there. It goes up to the Cas. The Cas goes to the DNA. It goes in and it can snip it. And that's how that works. It goes in. The thing is, it's a delivery system that is new. We've been doing gene editing as the scientists have been doing it for a while now, but they can't just inject stuff into the right spot and have it find the kidney issue or the liver issue. So it's been non-specific. So now this is a lot more specific. They can change DNA with amazing specificity. So this has incredible opportunities that go along with it, but there's also some, unknowns. Like what's going to happen if somebody with, nefarious intent gets a hold of, changing all our butterflies, you know what I mean, or whatever, you know what I mean?
Well, look,
so they don't know that.
Robin Hendrickson said, yes, health begins on the cellular level. Robin, that's awesome because Vern, now here we go. Vern, you should be joining us. Vern is a Renaissance man, every DP, cameraman, race car driver. He was up in a plane the other day I saw. Vern is a madman, knows it all, and his brother actually is one of the leading heart surgeons in the world.
Oh my gosh, that's
Vern,
great.
Somebody should join us.
Tell Vern we want to talk to his brother about stem cell. Let's get him on, because I've heard that I've seen it. What they're doing is they're putting, when somebody's having a heart attack or they do the surgery, they'll inject stem cells right into the heart. And they've studied these patients after months and months of recovery, and after 9 months or something, it's like they never even had a heart attack. It's amazing what stem cells are doing.
Absolutely. So Vern, and Robin as well, and all you guys and everybody else that's on there. What we're doing is basically just kind of riffing on some science, and trying to figure out what we're going to talk about on this next podcast where we invite a bunch of scientists. We've already approached about 15 people, and we're just trying to coordinate the time and get a very intellectual conversation going on. I will, of course, keep my mouth shut and listen more than I talk,
No,
because that's, you don't think that's
you
possible?
won't.
Okay.
Yeah.
Well then, Chip Hector, dude, all the way back from the swimming days with Chip, Princeton. So yeah, so we just think that the conversation. I gave a link up there, so anybody with a camera and a mic or whatever that wants to join in with us, feel free. I know Vern's got probably a lot to say. Robin, you too.
I got a question. Since you gave me such a hard time about all my people not being on here, but your people are. I want to know what all your people think about, like, your new beard, the way your beard looks. What do you think? Does he look more youthful? Because it used to be gray. I don't know if anybody noticed that.
Yeah,
Yeah.
it's a little, what is that? What's it called? Take the gray out. That's it.
Yeah. What is touch of gray?
Brian can't
Little
touch a gray. Remove the gray, man. Lee Ferguson, what's going on? We got Tampa, Florida in house. Isn't it amazing? It's such a wonderful time to be alive, and we're talking about science. We're talking about the future, and our next podcast is going to be amazing because we are going to have some great minds on here. And my cousin here, Matt here, he definitely studied up on organovo, which Bryce Burke, what's happening? Another stunt man. So yeah, we were talking about organovo last week, and now we're trying to round up, a conversation about regenerative medicine. So Matt, why don't we keep going there? So what else do you have to say about regenerative medicine?
Well, the cool thing about regenerative medicine, it's a whole host of things that are all about your body healing itself. Our bodies just kind of naturally age, just like a car does. It's out on the road, and I'm like 47, and Pat is much older. So what's happening is the body just it's got these mechanism of metabolism that repair itself. It's our metabolism. That's how we kind of wake up every day, and it's amazing how your body regenerates already. Your skin cells turn over at you wouldn't even believe it. I don't even know how fast it is, but like your skin cells replace each other like really quickly. So as you get older and the effects of aging and longevity, those mechanisms start to break down, and that's what we know as aging. And there's some people out there that are looking at aging and saying the effects of aging, we can impact that in a big way. So there's stem cell therapy, which a lot of people have heard about, but you might not have heard about the most recent stuff. Like, there's a paralyzed guy that they gave him stem cells and he started moving his upper body. There's a lot of stem cell stuff with like macular degeneration, and it's helped people that were like essentially blind. And there's heart attack victims. We were talking about your friend's dad, who's a heart surgeon. He'll know about stem cells because they're injecting it into hearts when they're doing the open heart surgery, and the people are healing in a way that is amazing. If you look at Texas was getting a lot of heat like 3 or 4 days ago because the governor proposed a bill that people can go out and you can't just get stem cells. You know what I mean? Like, I'd love to get them from my doctor or whatever, but and if you're suffering from a disease and you're trying to be your own patient advocate, it's very difficult to get this technology that's in its like early stages unless you're in like a university trial of some sort. But the information that's coming out is like wonderful about what it can do for your body. Now, I'm in sales for a construction company, and Patrick's a stuntman. I'm not trying to sell you on anything because I'm not.
We're just trying to get.
Yeah.
We're just trying to get the conversation going. So any of you guys out there that want to join in the call and just chit chat about regenerative medicine or anything having to do with health. I know from playing, and I got Scott Cook and Stephen Biles, who I played soccer with at University of South Carolina. They're part of the chat here on Facebook Live. So cool. I noticed, and I don't know if anybody else, and just kind of holler back at me if this has happened to you, but I had real big thigh muscles, and my thigh muscle started to actually deteriorate, almost like a shark came in and like just took part of my muscle apart, right?
Yeah.
So it started getting deeper and deeper and deeper, and I was thinking, oh man, what am I going to do? So what I started doing was getting massage. I started getting acupuncture, and started working out, paying attention to my legs again because I hadn't been running, I hadn't been lifting or whatever. So I started actually building it back together, and the
Nice.
acupuncturist was working. With the what they do is kind of poke the needles in there and stuff and try to bring blood flow, whatever. But also eating better and some vitamins and stuff like that have dramatically brought that muscle back to my leg. So
Yeah.
there was no drugs, there was no any kind of no doctors involved. It was just pure
Well,
simple health, walking,
that's
paying
great.
attention, and regenerating the cells. Because ultimately, it's if you can awake those cells, you can get them going. You can hustle them back into thinking that you're young
Do me
again.
a favor. Do me a favor. Pull up Organovo and University of Virginia partner for volumetric muscle loss. Now, I'm not talking about somebody that can necessarily do, acupuncture and working out at the gym, but there are like people that lose large bits of muscle, like whether it's military or there's other reasons why people will lose it. And they just partnered like last month, and that's
This the
Organova
one?
collaboration with the University, yeah, that one. University of Virginia to develop bioprinted tissues for volumetric muscle loss. Go down and let's read about VML injury. Let's see. 3D bioprinted for volumetric muscle loss. The research will take place in the laboratory. So somebody like this, listen, if there's somebody on here that I know a guy, AJ Genovese. He's got muscle loss in his arm. I want to tell him about this laboratory of George J. Christ. Maybe he can be part of a study that will you know, help help him. I don't know. But I mean, I would do this for myself. I'd try to find this for myself, is what I'm saying.
We got
But
Drew Paff. We got Drew Paff tuning in. Do you
what's
know?
up, Drew?
Do they have a program for brain loss at all?
Is that for Drew?
Well, yeah. I mean, other than sports, he's kind of lost everything else. But he knows everything about sports. No, just joking.
Last time I saw him, he looked pretty sharp.
Now Drew's in shape. Drew's got it going on. Drew rolled up on a body in the Trenton Canal the other day. A dead body. Went to walk his dog, and he rolled up on a woman that had, I guess, shot herself. Isn't that crazy?
Yeah, that guy's past regenerative medicine. Once you get to that state, you can't come back. Just saying.
Yeah, it's crazy. So we don't have any questions about. Let's see. We don't have any questions about the
Let me tell
future
you.
of
All right, shut
science.
that down. Shut that down.
Okay, that's it.
So what I'm trying to do, and I'd love it if all of Pat's people came on board to check out our next show, because we're gonna have this guy Aubrey de Grey. Pull him up. Can you pull him up? I'm
Sure,
sorry to keep telling him what to
it's
do, but it
okay.
really is the Matt.
I'm
It's the
just your
Matt and
I'm your assistant.
so, but you're the control.
Okay.
Aubrey
Aubry Aubrey. Last name?
space de de Gray, Gray.
Okay. I think it might have been. Oh, it's actually Rey. Okay, and this guy right here with the long beard.
Yeah, the long beard guy. Show everybody the
Oh
long beard
shit!
guy.
I might have to. I'm about to shave my beard now. This guy. Wow.
Show this
This
guy.
guy's awesome.
This guy is awesome. He's
This guy's
from
awesome.
Cambridge University researcher. This dude. Blow up his. Yeah, yeah,
Look
yeah.
at it. Look at that beard. Jesus, dude.
Dude, that's the dude. I want a shirt with. That's not his beard though. That's not Aubrey de Grey. That's just a dude with a beard, dude. Get out of here. You're like a beard fetish guy.
Uh,
That's Aubrey de Grey.
uh,
No,
that's not Aubrey de Grey. I think I
that's
know that guy right there.
isn't that the actor? What's his
I
face
think it
that
is
got
the
in a lot
actor.
of
Yeah.
trouble?
Is this
All right,
it?
Aubrey de Grey. Oh, go back. Go back.
Back where?
Click on just like, like back.
Back
It's
what?
like,
Backspace? Back to the last article that you said that you want to see the actor? What would like
at
to
the
see?
top left of your screen, you got that. Oh, see, go down twice. A roadmap to end aging. Touch that one. Boom. That's his TED Talk,
Wait, this
which,
one right where I'm on right now, or no?
oh my gosh, go up one. You see him with the beard?
Oh, you want the video?
Yeah,
We,
oh, you're the worst. Yeah. I mean, you try to tell a guy what to do.
Let's go.
This
This
guy.
is on.
How many views did that have?
I don't know. You're asking me a million questions. You're just sitting back, probably eating a Hostess Twinkie.
Take a wild guess. How many views? I mean, if you look closely.
It says 3 million.
Here we go. I'm going to
this guy.
talk about 5 different things. I'm going to talk about why.
I encourage everybody to look this guy up and listen to his talk.
And actually talk about this a bit more than we do. I'm going to talk
Nobody
about
can hear
as
it,
well, of
Pat.
course.
I can't hear it.
About why we are so fatalistic about doing anything about
Can't
aging.
hear it?
And then I'm going to spend perhaps the second half of the talk talking
only
about
you can hear it.
Why we
And you're
might
shushing
actually
people.
be able to prove that fatalism is wrong.
All right. So, anyways, he
Okay.
talks about
Whoa,
aging,
he
but
talks. This guy talks very fast.
Well, he had
Very
18
fast.
minutes. He had 18 minutes to do a presentation, so he was cramming it all.
Okay.
This is the guy that we're going to have on here with us by next week. And not only that, he knows. All right, he knows a lot of people now. That video was from 2005.
Matt, hold up.
How to get from a relatively modest amount of life expectancy.
You can't hear, but everybody else can.
As 30 years applied to people who are already in middle age.
Oh, well, that's great. Thanks a lot.
Did
you do that on purpose?
Called defeating aging, namely
because of the beard comment, because I said something about your beard.
Just give it a second for this guy.
Die in the next year, or indeed to get sick in the first place. And of course, the last thing I'm going to talk about is how to reach that intermediate step, that point of maybe 30 years life extension. So I'm going to start with why we should. Now, I want to ask a question. Hands up, anyone in the audience who is in favor of malaria? That was easy. Okay. Hands up anyone in the audience who's not sure whether malaria is a good thing or a bad thing. Okay, so we all think malaria is a bad thing. That's very good news, because I thought that was what the answer would be. Now the thing is, I would like to put it to you that the main reason why we think that malaria is a bad thing is because of a characteristic of malaria that it shares with aging. And here is that characteristic. I mean, the only real difference is that aging kills considerably more people than malaria does. Now, I like in an audience in Britain especially to talk about the comparison with fox hunting, which is something that was banned after a long struggle by the government not very many months ago. I mean, I know I'm with a sympathetic audience here, but as we know, a lot of people are not entirely persuaded by this logic.
He dresses like you,
Pat.
Pat.
Actually a rather good comparison, it seems to me. A lot of people said, well, the city boys have no business telling us rural types what to do with our time. It's a traditional part of the way of life, and we shouldn't be we should be allowed to carry on doing it. It's equally sound.
Wow. Okay, we're gonna go back. We're going back.
That's 24 minutes long. It's a great one to look at, but that's
all right. So anyway, Lori Reeves, what's up? Rick Doldy in the house. Tom, what's up? Hey, so what I just looked at that. I don't know how many people got to see that or listen to that. I know it was a little late on bringing the video up, but the guy is extremely intelligent. You could just see by the way he looks. I mean, his beard has that intellectual beard. I have that, like, I don't know, that Mean Joe Green style. That's what I'm going for. So
you're looking like Grizzly Adams with like the hair and maybe it's the shirt too. It's kind of dark, Pull up Grizzly Adams real quick.
Hold on. We got someone coming in on YouTube that says, hello, and what is this channel about? Matt, you want to answer it real quick this time?
This is the Matt and Pat Show. What we're about is bringing information to our network and beyond about interesting technologies that will change people's lives. We're on the cutting edge of technologies that are happening right now. Today, it's regenerative medicine, just real generally. We're going to be bringing in experts on the next meeting, next one we have.
This
is that short enough?
This is just a prelude to what is to come. We're just kind of fishing for what people might want to know about, and we'll go out and we will fish the right people up. Right now we have about 15 amazing scientists that are all just trying to work out the time. We'll announce when we're going to have that podcast. The guy that we just showed, Aubrey, is a what is he? What's his education?
Was a Cambridge researcher. And
I went out with it. Just a side note. I went out with a, believe it or not, I don't even know how I pulled it off, but I was in England with Bomber, and we hooked up with a mother-daughter combo, and she was young. I mean, I was a lot younger. She was a professor at Cambridge.
Wow, was she a knight?
How did I pull that off? I have no idea.
Was she a knight?
Huh? Was she what?
Was she a knight?
Was she
knighted by the Queen?
No, I don't think she was. Was everybody at Cambridge knighted?
No. But this guy's not a knight either. One day he will be, because the stuff he's talking about is super cool.
Yeah, definitely. How do you guys feel about the head transplant? Whoa, that's a good question. Can you introduce yourself? Kizell 627's in gray. Oh, Kizell, there you go. Look at my man, knows the deal with the glasses. Who knows that? Okay, Matt, you want to answer that? You want to answer about the head transplant?
Yeah, the head transplant was a guy from Russia that said he was gonna be able to transplant a head. It's a bunch of malarkey. There's no way. That's what I say. That's my medical opinion, and I did not go to medical school, just so you know. So there's no way.
Wes is 29, and he says, "Yeah, buddy." So I'm thinking, that it's actually possible, because it's really about blood flow. I mean, you might not be able to say, like, let's say I need a head transplant.
So it's about
or Matt needs a head transplant. Let's say my cousin needs a head transplant. So we go in there, we got the same blood, we're relatives, the whole thing. There's no way. Like, I think you're going to get him walking around, he's going to be walking around, but he's definitely not going to be.
You're chasing the wrong conversation right now. You're going to turn a head transplant.
I got another cousin. I got another cousin on the line, Patricia Moore.
I'll tell you, if you want to know my weird, you want to know the one that's really weird that I think will happen?
Okay, hold up. Let's say we got Wes on here. He says, "I know the story behind it. I call absolute bullshit. Here's why. The first would be to repair severed spinal cords on paraplegics." Well, I think it's going to be a step-by-step process, but I think in the future, potentially, I wouldn't rule it out, but it would be a little scary.
Well, is he saying bullshit, what I'm saying, or what he's saying?
He's agreeing with you. He's saying that it will never happen.
Oh,
I think it might.
Right on.
I think it might happen. Mac Tavares, I enjoy you guys and how you try to. Do you want to just slow down? Mac Tavares, I enjoy you guys and how you try to educate the masses. I am a big believer in chiropractic and how it aids the body to heal via the nervous system. When your spine is aligned, everything works better. I have a doc that is awesome. He works on professional football players and many other athletes, as well as families for wellness care. I can share his info if you're interested. Might as well share his info. Let everybody see what's going on. Why not? I totally agree with the whole health routine. I mean, health is wealth. You get out there, you get to the gym, get some running in. My cousin is a marathoner. He looks like a little greyhound. He's a little skinny for my taste, like he's like, I like to have a little,
but I don't die
more of a sprinter. He's got that greyhound style. But I'm gonna do my first marathon in October. I'm pretty excited about it. And he said he's gonna stay with me, but I know he's gonna be. I know it's gonna be 5 miles, and he's gonna go watch the greyhound run.
Stay on topic, okay? We're trying to educate.
I know the story. Okay, what do you say? I only asked because it was talking about stopping aging, which you would. If billionaires didn't want to die, they wouldn't have to. It's playing God. Yeah, I mean, look. I mean, come on. Let's just check it out. Let's check it out.
All right, go to SENS.
Now, when you look at
what?
When you look at the guy that just recently died, right? there's two guys,
There's 100,000 people a day that die.
one of the wealthiest guys in the world, Rockefeller, right? He died. He had like 5 heart transplants at home. I might even, I don't know how many exactly it was, but it was up there. So, how many transplants did he have? 5 or 6 transplants, something crazy. He was 100 years old or something. You know, the guy would have died if he didn't get a transplant. So you don't think that you don't think we're going to elevate that level? But listen, beyond elevating the level on repair, it's going to be it's going to be don't get sick. That's the problem. That's what we need to attack. Don't get sick. And then your age, you'll be able to live healthier, longer lives. Don't get sick. Stay out of the hospital. Take care of yourself. That's all I'm saying.
Thanks for your public service announcement. That was really great. But I want to go back to your guy that said, you know, aren't you playing God? The rich people are going to get it. That gets back to that's into wealth distribution. And I understand what you're saying about that. The other thing is, aren't you playing God? There are a lot of people that say that we should just age because that's how it's always been. But if you look at the age life expectancy from the 1800s, you were 50 when you died. Then you get up to ours, you're 80. It's a natural progression, but based on penicillin and medical advances that have happened throughout time. We should at least pursue these opportunities and then say, okay, well, we could save this person suffering from Alzheimer's. Do we want to do that or not?
Yes,
that's
we do.
up to you. That's a choice. But if you don't actually pursue these therapies to say, hey, do they really work? Can they work? If we don't do that, then we don't even give them the chance to make a choice. So no, I don't think we're playing God. We're working. And then why God could stop us from doing what we're doing, which is just following kind of a scientific thing. We already use medical devices in people. People have replacement knees. They have titanium hips. They have pacemakers. You got a problem with that? If it was your dad?
Well, my dad had a pacemaker, and I think it was false hope. So instead of going out into the gym, just a wake-up call prior to getting the pacemaker, I think would have been a lot better, a lot better medicine. Hey, you're going to die. You're not going to have this push button technology that's going to push you along. It should be take care of yourself. And it would have been a lot longer, healthier life.
I'm not here to get into an ethical discussion about whether or not we should pursue therapies that create longevity in life. It's more about the techniques that are being used, that are being approached right now. And I don't think it's a good enough answer to say, oh, we shouldn't do it because population growth or some other thing. I get it. There's other things that'll happen as we advance our ability to combat longevity. But I'm telling you, it's coming. And if you want to keep your eyes closed, fine. But this is a great opportunity to look at some of the future technologies that are coming down the pipe. And I think they can help people.
I agree with you 100%. I mean, that's why I'm invested in Organovo. It's a cutting edge science. And, I just feel that, it's an awesome thing to be able to give people in unfortunate circumstances. Maybe it's a genetic thing. Maybe it's just getting caught up in alcohol or whatever, and they lose their liver or whatever. And then here you go, you got a backup system like what Organovo is doing with skin tissue, liver tissue, kidney tissue, and can actually.
So what Matt's talking about is regenerative medicine, is all the therapies that contribute to repairing the body. So Organovo, Patrick and I are both invested in Organovo, and they're coming out with a 3D printed liver tissue patch, specifically for inborn metabolic disorders. It's a pediatric or it's an orphan drug status thing with the FDA. They'll be submitting in 2020 for that.
Nice.
And that can help people that are going to die if they don't have a therapy.
Chad Hessler, what's up? Another stunt man. So our buddy on YouTube is saying, why he found us. So he was on YouTube surfing around looking for talk on live talk radio, or live video cast or whatever. He says, you guys are the only channel worth watching that isn't bullshit or gaming.
Thank you.
Have you heard about the fish skin being used for burn victims overseas? I think it's fantastic. I haven't particularly heard of that, but I know this company that we are invested in.
Pull up Organovo and L'Oreal so the guy can see it and he can go search it himself.
Okay. Hey, for the future, don't get all hushy, hush, puppy with me, dude.
I think you might have shushed me about 7 times when you were putting up Aubrey de Grey.
I'm very sorry about that, cuz. All right. So, what would you want to say Organovo?
And L'Oreal. This guy's going to be, he's talking about the fish for burns. Organovo, it's amazing. They print 3D printed skin, human skin, that they've partnered with L'Oreal to, and you'll see it right here. They're partners. L'Oreal partnership with Organovo. They're printing skin already with L'Oreal. They haven't studied it for burn victims yet, but it's L'Oreal's plan to print. I mean, look at that. Can you see that on your YouTube thing, man? This is for real. This isn't now. This is last year. When's the press release? What's the date?
We got May 5, 2015.
So they've been printing skin for a while, and then L'Oreal is using it for toxicity testing of cosmetics. Huh?
No, I'm just giving shout outs to people coming into the group.
So L'Oreal is using it for toxicity testing. They're working with different cell types so that they can have different skin types to make sure that their cosmetics are testable. Over in the European Union, they banned all animal testing. And so what then these giant cosmetic companies were doing is they were sending all their cosmetics to like Malaysia to be tested on animals. And then the European Union found out about that and they said, ban animal testing 100% no matter what. So this 3D printed skin tissue they're going to be using with the cosmetics, but it's not a leap to imagine that they can use this for burn victims. Now there's other therapies that are happening, I think, with burn victims and wound victims. But this is really promising where they can print skin tissue. I'm telling you.
Absolutely.
So not far away, man. So forget about fish. Let's go right to human cells. And then furthermore, if you want to learn a little bit more, look up iPSC. Type that in, Pat. iPSC cells. And you're going to figure out, you're going to see why this is important. So let's say I get burned, right? And you've always got to worry about like rejection from your body of other people's cells. Look at this. Induced pluripotent stem cells are derived from skin or blood cells that have been reprogrammed back into an embryonic-like state that enables the development of an unlimited source of any type of human cell needed for therapeutic purposes. The dude that did this from Japan won the Nobel Medical Prize like 3 years ago. What they can do is they can take my skin cells or fat cells, whatever, and Pat's, and I can make any cell in my body, a cardiac cell, a skin cell, an eye cell, any cell of mine, and turn it into a tissue or a replacement. So this technology right here is what's happening right now, and this is UCLA at the top of it. It's not like I'm giving you like some, you know.
So Matt, let me jump in there for a second. So Wes is talking about, you know, he says that it's great. He's able to screenshot what we post. Let me get off this real quick, and then he said he's going to go to it later and check out the companies because that sounds like it might be some good investing suggestions. Again, we don't have anything to do with these companies other than being investors. And I know you keep going like this, but it's important that we say that we don't have any connection other than just being, we're out there. It's the Wild West. It's such an amazing time to be alive because these things are
All right.
possible with technology and science. Go ahead.
All right. All I'm saying is you add about 10 words that you don't need to. We're investors in Organovo. We don't work for the company, but that was from the UCLA site. You can check that out. We just happen to be talking about it. What I wanted to say to your man is you can screenshot this stuff and look at it later, but we're also recording this and we'll post it on a YouTube channel, Pat Walsh's YouTube channel, so that if you type in, I don't know what you're going to name it, the Matt and Pat Show, Google the, like in YouTube, the Matt and Pat Show, because I'm a little better than he is, but you can just scroll through this and you'll see everything that we talked about. So anybody else that wants to jump off, watch it later, whatever.
Yeah. And then we have Mac Tavares who came up with that. Dr. Jody Serra in Lebanon, New Jersey. That's the guy that everyone needs to contact. He's a chiropractor and an athlete. He has worked on people in the stunt community before, and he believes that power that made the body heals the body. I agree with him.
And
check out his number on. Good.
We were both born in New Jersey. Bring up the little picture of us in New Jersey. Show them the picture of us.
I can't bring it up, but I can show it to everybody. That's back in the day, way back. You see, I'm a little taller, a little bit more muscular than he is, and it's kind of stayed that way. He probably can beat me in a marathon, probably. In a sprint, it's not happening, but I'll give him the marathon. He told me I'll never even finish it, so he has a lot of confidence.
I didn't say that. Listen, let's get the story right. I'm an encourager. I'm not a downer. So here's what I said. I said, Pat. He said, oh, I'm going to run one of those things that you did, a marathon. I said, oh, really? Okay, well, you got to follow a plan. And he said, nah, I'm not going to follow a plan. That'll ruin my knees. I'm just going to come up and run it. If anybody that knows Pat, you know that I'm telling you the truth. I said, okay, when are you going to sign up? And so he signed up that day. But then he started running, which is good because you cannot just show up and run a marathon. So that's what I was saying. You're not going to do it. I mean, it's like crazy.
Okay. So, thank you for the confidence. So, where's this guy? He says, have you heard about when Pat goes live, are you two in the medical field? Are you brothers? No. Wes, we are cousins. And
we're cousins.
The older one, and no, it's hard to believe, but I'm a few years older than he is. And
he died
we are not in the medical field, but we were very interested in the medical field. I've always been interested in the medical field as just being an athlete and just always trying to figure out how to stay healthy is really important. So
I was a pharmaceutical rep. That's not really the medical field, but it is some scientific background. But we got into this by investing in Organovo. It was a weird weekend. I came down to New York and ran the New York City Marathon. We stayed in that very place that Patrick's sitting in right now. And with my buddy, and his daughter was at Fashion Institute of Technology and brought up 3D printing. Pat did 3D printing. And then I was just Googling 3D printing because we had invested in some 3D printing stocks. And then I happened to find Organovo. And with my pharmaceutical background, I knew that printing human tissues, I just saw it. It was like it was going to work. And it is. They partnered with people like Merck, L'Oreal, which we showed before, Bristol Myers Squibb, Harvard, Yale, Knight Cancer Institute. They're printing, pull up the Knight Cancer Institute in Organovo. They're printing breast cancer tumors. Pretty cool. If you can imagine them printing your own type of tumor and in a dish and trying it on like 42 samples of them and finding out which therapy works the best before they put it in your body, that's the type. They're going to find cures based on the technology that is going on. Did you get Knight Cancer Institute? And that's Phil Knight. If you've never heard of him, he's like the Nike guy. He's got a little bit of money. Just a little bit of money.
Yeah. So, Organovo is doing some special things, obviously. When you were talking about the skin for potential issues with burn victims and stuff, L'Oreal and Organovo have a partnership, and if you know about the past of L'Oreal, I mean, they're a private company, they're a huge private company. They spent $1.2 billion in 1 year trying to
I don't know
generate
about that.
enough human skin. Marv, you got can you? I'll research that while we're talking. But
You keep saying
anyway,
it. Every
I
time
just
we
thought,
have a,
come on, man, I'm running and gunning, and you got me doing
well,
shows. I'm doing
if you
like
say something
happy
that's not
hour.
correct,
I got the
you're gonna.
game on at 9 o'clock.
I don't know
So
that that's
it's a
correct, is
dollar
all I'm saying.
size. It's a dollar size bill. A bill,
They
dollar
spent a
bill
lot of money.
size of skin. They spent a lot of money. $1.2 billion is what I read,
I
and
don't
I'll
know
post
that.
it. I will post it. Well, I'm telling you. Do you trust me?
I do
Okay.
not trust.
So now they're in a partnership with Organovo, who has this amazing 3D bioprinter that's pumping out skin, and I hear it's pumping out skin tissue. So
You
we
don't.
don't we
You don't
haven't
hear.
heard a lot about the partnership, but they are definitely, are they through the second phase, or what's the deal with that?
Yes.
Are they
Lena sent that on. Lena, right? Helena.
Lena?
She sent on a. There's some. Yeah, they're still working on stuff together. So
All right, so
anyway,
Wes is on to another topic here. So just to talk
stem
about
cells.
that, Wes, when you think about L'Oreal and their partnership and actually printing, so they do three different kinds of skin. They do skin tissue outside the body, then in vivo tissue, which is like your liver and kidney skin, and they're taking that tissue, and they are, having pharmaceuticals. It's toxicology testing. So pharmaceutical companies will use this, tissue to potentially even do disease modeling. So if you have like a kidney or liver with fibrosis, they can
Nash.
duplicate it, or NASH, whatever. They can create that
Nash,
disease
whatever.
model.
It's affecting
Well, you
Nash
know what I'm
is
saying.
affecting 30% of the developed world will have fatty liver disease.
Tissue disease, yeah.
Yeah. So
I think it's
that's
33%.
30% of the developed world or no, it's just progressive fatty liver disease. It's called NASH, NASH. It's a
Yeah.
big deal. And Organovo is printing liver tissue with
So that,
hepatocytes, stellocytes,
yeah, so they're
like
able to
making.
they're able to 3D print these disease models, and then they can test their pharmaceutical, like, potential, drugs that might help those diseases. So that's pretty cool. And then they also are thinking about, or they are doing, and they're testing right now on mice, and they're getting amazing results, is 3D uh, 3D printed tissue, liver and kidney tissue, that would go into would be like a patch. It would act as a patch, and it would go in and sew it onto, a liver or kidney in that
Not
affected.
kidding.
Well, not yet, but that's a plan.
Liver.
Liver right now, they're
Just
in
don't
they're in
say
like mouse
anything.
studies.
No, they're not doing any studies in kidneys. So don't say. I'm just saying
I said
it's.
liver, but I'm saying the future would be they're going to be creating
They might not. How do you know that
small.
that's good? They're going to do.
Okay, well, I'm saying the future is that they're going to create patches, and then they believe that these, like, patches of tissue, liver tissue, they can take on the affected area, and it will go on there, and then it will adopt to that physiology of that.
That is exactly right. And not only that, they've done the
Well,
first
if you
study
give a
for
guy a
30
little bit of chance to explain,
You're
I'm a
saying
roundabout talker. I don't get right to the point all the time.
no, you're a very loose talker. That's the problem. You're saying, liver and kidney. I don't know, they're organs. But
Okay,
no,
all right.
you do both of them.
Is
There's a
it
big
loose
deal.
loose lips sink ships? Is that what you're trying to say? Okay, so let's
Well,
move on. We obviously know that they got some great technology, some great science, so that we're excited about that.
let's
So Wes
hey,
wants to know, and we got to get your, I know it's. I'll send you $100 to get like a headset, because we're getting a lot of reverb, but that's okay. I'll get that over to you.
crap.
All right, so it's a
You should
family
have told
show.
me.
No cursing, man. Okay, so let's see where you're at here. He's talking about, Wes wants to know, you said we're past tense. Did you hate being a rep? He wants to know if you hated being a rep. And the next thing is, with 3D printed human cells, could a amputee have a limb regrown in the future? Ooh, that's interesting.
Did I help with the reverb?
Yeah, it did. It did.
Well, you
So
should have
look,
told me that about an
he
hour
wants to
ago.
know, and it's got to be really. Well, it's just something that you want to come to. You want to be prepared. You want to come to the table ready. You know. So
So
he wants to know. There's
did
a
I
couple
hate
questions
the
because you're being a little bit late on this game. I'm trying to catch you up. So Wes here on YouTube, he wants to know: did you hate being a farmer rep? Maybe what do you want to do in the near future? And then, with 3D printed human cells, could an amputee have a limb regrown in the future?
Wow, that's interesting questions. One, I did not hate being a rep, but I did it for like 8 years, and I definitely lost some steam. But what I'm interested in doing now is doing the best job I can at the job I have, which is actually in commercial sales of commercial flooring and ceramic. But I'm definitely interested in regenerative medicine as a field, also Organovo, great company. So any of those type things is interesting. I'm definitely interested in. Now, as far as the regrowing a limb, an amputee, obviously there's a lot more to that, but it's possible that the stem cell conversation that we just had may be something that's on the horizon. If you look at the arm, hey Pat, you there?
Yeah, I'm reading some. I'm reading some stuff. You keep talking. Don't worry about what I'm doing.
Okay. Well, do me a favor. No, because you're going to help me. Your control.
Okay.
Pull up like a newt,
Can we hire a
like
secretary? Do we have them funds for a secretary?
I'm trying to
Okay,
help your
what do you
guy
want
with the guy with the
All right,
amputated
what do you
limb.
want to
Now here's the
know?
question.
Go. What do you
All
want to
right,
know?
you don't even have to pull it up. Don't worry about it. The guy can do
I
it
can do
himself.
it.
He can watch this later.
I can do it.
Nah,
Go ahead.
I
It'll
don't
help
really.
everybody.
I don't really know where to go. But here's the thing, dude, is that when you're a kid, before you reach the age of like 5 or something like that, it might be 4 or 6, I don't know. But if you cut off the tip of your finger when you're like young, your body repairs itself. And it's kind of like interesting. When you get older, it doesn't do it. So there's something to our body's ability to heal itself that is there in our genetics, but it's not that. So if you were on this call, we looked a little bit at iPSC cells, which are stem cells that can be derived from a patient's own skin cells or fat cells and made into any cell at all, like muscle cells. The key problem with any of that is really the nerves. I don't know what's been done in the nerve world, but tissue wise, so I don't know. That's a tough one. I would say that it's not possible, but there are
Limbs.
some animals that regrow their arms, and they're
Starfish
studying that
regrow.
now to say why. Starfish, salamanders regrow their
Octopus.
tails and stuff like that. Yeah,
No, I mean they.
and I mean
I
you
wouldn't
think
say
about
that. I wouldn't say that
yeah.
anything is not possible. So, but
Well, it's
it's
just
definitely
opinion. I'm a flooring guy. I can give my.
it's definitely a
It's this
reach.
is this is our show. We could
I just
say
don't like the
no. I don't
limiting.
think
I
it's
don't like
possible.
the limiting. Your next, like your screen is right there. I want to when you start limiting the ideas. I want to kind of.
You're like, how old are you, by the way?
I don't. That's not a question I answer.
I
It's the why.
think you
How
might
old
be too
people?
old
I think
for
people. I
that
think people.
skateboard.
No, but I
I think you
think
might be
people
too old for
grow
that
at different
skateboard.
rates. They actually grow. People age differently. We're talking about aging in the future, and you're asking me how old am I? Like how much? So you could say, I don't know. I
He
don't like the
dyed his
question. You can
beard.
ask me when. You can ask me when I
I know.
was born.
He said it. He said it was for a part. He's like, yeah, I'm working on a part. And I said, how long did you practice that in the
Oh,
mirror? Can you imagine? So when's the
oh
last
man.
time you
Okay,
rode
so
that skateboard? When's the last time
okay.
you rode the skateboard, Pat?
That's a
Go ahead,
brand new
tell a lie.
skateboard. I rode it once. I rode it. Somebody took my old one. I rode it once about a week ago. So I'm about to get on it though every day. How's that?
You're gonna have to
So
regenerate a hip, I bet.
okay, so
Go
look.
ahead.
So random. He says that he said that your daughter, it wasn't his daughter, it was his partner's daughter, his business partner. the Fashion Institute. You might find the Human Skin Project from Alexander McQueen. After his suicide, they grew his cells to make bags and shoes from it. Well, oddly enough, the guy that created Organovo, Gabor Forgax, he is now his son, and I believe him.
Pull it up, Modern Meadow. Pull it up.
Okay, we're going to pull that up. Modern Meadow.
Yeah, because I just told you.
Hey, did I not?
That's why it's the Matt and Pat show.
I don't think we want to have a competitive talk show where the two.
What are you talking about?
Did you?
You mean between me and you?
Yeah, leather reimagined. Excuse me, reimagined. Okay. So
leather and meat. They can print meat.
Gabor and his son Forgax are doing just that, printing. Excuse me. Excuse me. Thank you. Excuse me. Oh,
yeah,
hey.
The 3D. Go to our technology.
Okay, so
biofabricating the material.
We design, grow, and assemble collagen. So they're doing some really great things by printing leather goods, much like you're talking about shoes. I'm not so sure about skin.
They print meat.
It's more leather.
You can eat it. No, it's meat too. Google it. Modern Meadow prints meat. Do that.
But now we're kind of getting just.
No, this is good stuff. This is all part of the same thing.
I don't know if we want to be printing meat. I mean, that's just.
Why not?
I don't know. I mean, maybe for some third world countries,
Yeah, for starving people, dude.
Okay. Well, I'm hoping not to get that far into being hungry.
Well, expand your circle, dude. You got a skateboard. I mean, come on.
All right, and this dude skateboards too. Hey, Wes, do you have are you missing any limbs or something? Are you?
That's a little tough question to ask. Just in
Why not? That's whatever.
Hey, Wes, this is gonna be a highlight of our show. You got to remember that one. The insensitive question.
I'm not a PC guy. What am I gonna say?
This article was written in February of 2015. So what do you think they've been doing in 2 years? 2.5 years.
Let me see what he says. He says about fiber. Nah, maybe a marble in my head or two, but complete. He's complete.
Yeah.
Okay, so let's see here. Let's see.
That.
Let me get out of this thing. He's talking this, which I don't know about, which could be cool. So he's saying this stuff here. Can you see this, Matt? Are you seeing this?
I don't know, but I like camping. Man, that looks fun for a little bit, but I also got a family of 5, so it looks a little cold. Dyneema fiber.
Dyneema fiber, composite fabrics, formerly Cuban fiber technology. Wow. The following is explaining the difference between fiber, composite fabrics, Dyneema, still technology for mountain gear. Oh wow, ultralight. Well, that's cool. Interesting.
Yeah, that's fiber.
It's not 3D printed or anything, right? How is it?
You can make a tent or a jacket.
Interesting.
And then you can print on the jacket. Go Onvo.
Light and super strong. I like it. Stacy Sander, Viviana James, Louis Antonelli. What's going on? Well, we got a big player, Wall Street player in the house. Watch out.
Good.
We got
Shut the big screen.
On the air.
We're not selling tents.
Okay. Anybody else, Stacy? Anybody have any fun stuff that we are going to be talking about in the future podcast? Probably sometime this week. We have about 15 great scientists that we're going to have on. We're going to have about 4, 5, 6 people in a discussion. Matt and I will be moderating. Matt will pretend that he knows what he's talking about. I'll probably just be kicked back.
Talking. You'll just be talking.
And I mean, you know, I'll create the audience, I guess. I don't know. I mean, I haven't seen it. I did actually see one of our cousins, Matt's sister's husband, was on Kaweki.
Matty!
I think Kawex is still in the house. So
What's
shout
up?
out.
It could
to
be
the
Rachel
cousins.
or
Could be Rachel on Matt's, you know, computer.
yeah, What's going on, guys? That's the family.
We
All
got
right,
Laura
listen.
Ferraro. I actually
This
think
is
she's
not just like-
I think she's another one of my friends from home, and she might even be a scientist. Her father, by
Fine.
the way, her father,
Yeah.
Charles, was one of the smartest cats around. He was part of the Los Alamos project back in the day with like Feynman and all those guys. So
Yeah, that
he was a
Los Al-
great,
wait a
great,
minute.
great, great
that's not
guy.
the,
Shout
the
out
Manhattan
to my boy.
Project.
Yeah,
The hydrogen bomb you're talking about?
all that
Los
stuff.
Alamos.
Yeah, that was
Is
where
that where
it
they
was.
did the
That's where it
bomb?
was. That's where they did it. Yeah.
Mm.
But you know.
All right, well,
scratch the surface.
listen, I get that it's like a shout out party for you, like, hey,
Well, I
look,
mean,
look at that. Oh. But how about if we
Well-
bring up another article? I want to take a look at something.
Well, look. Here's what Wes says. They use it for sales, but if you think old skin on frame canoes, they could be used to make yachts and limbs if rigid. Oh yeah. So you know what's interesting about that, Wes? If you have a connection to that company, there is a company in my building here that they are basically, it's called the Achilles Foundation, and what they do, the guy was a marathon runner, and he was filling up gas
I like 'em.
at a pump, and he was in the back of his car, and he was, when they had the gas, when you used to fill the
Is
tanks
this a
up
long
in the
story?
back. No, I'm going to try to make it short. Well, he was filling
Okay.
up, and a car smashed into him, and he lost one of his legs. So he sued the New York Runners Club, and he said, you know, I should be able to. It's not like you should be out. You shouldn't have to qualify. I'm a paraplegic, and I want to run the race. And they were like, well, you don't qualify. So he sued them, and he started this cool company called Achilles International, and they had to let him race, and he won the case against the New York Runners Club. So now that's why you see a lot of disabled people running, and you know, pushing on bikes and stuff like that in a New York Marathon, and that's in my building, and I'm sure they would love if that fabric and stuff is really lightweight and durable.
Yeah, maybe
I'm
they
sure
can make
something
their
he might
stuff
be
out
into.
of it, and then they'll be faster.
Yeah, that would be a good little competitive edge. So if you know of anybody in that company, or if it's your company or whatever, holler at me, and I'll pass the connection.
Hey,
on.
and while you're at it, I was just thinking about sailboats. Like, if you could make sails out of that, if it's that strong, you
Yeah.
could probably get a few more knots out of that wind. You know what I mean?
That's what I said earlier. That's what he said. Sales. That's what.
Oh, sorry. Yeah, I didn't
It's
hear
okay.
you.
It's okay. Now your sister is on with Alex and Matt.
What's up?
Yeah.
That's great. How you guys doing?
Matt looks good on TV, doesn't he? Look at that smile of his.
Look at
That
Pat.
that
Hey.
Colgate smile. You can't even see my teeth.
Do you guys like the way that Pat colored his beard?
Yeah.
Is it nice?
Touch of gray.
He feels a lot younger.
Let's see. He says it's stronger than steel.
Yeah.
Yeah. All right. So what are we going here? So
We're going to
Stacy
stem cell.
Stacy says I had stem cells injected in my back, and it fixed
Yes.
my back, which means no surgery.
That's what I'm talking
Stacy.
about, people.
Stacy, why don't you hit us up at the link and come on and tell us about your experience? HTTP : there we go. What is it? I think it's.
There's going to be more and more people that are benefiting from stem cell therapy. It's going to blow your mind.
Yeah, let's do it. Stacy, come on in. Get hooked up. Even if you're on your cell phone, grab a camera.
Yeah, tell your story. Tell your story.
And tell your story online. We need you. We're just having fun. This is only supposed to be a 10,
Now,
15
listen.
minute podcast.
Listen,
Now we
if
got,
you wanna-
I got
if
my
you wanna-
cousin Andrea and her husband.
Yeah,
And my.
yeah.
I'm going to be a second cousin.
Put us up
Alex.
on the big screen on the TV. Hi, guys. How's it going?
Oh, wait. Awesome.
Uh,
We were talking, Andrea, I don't know,
Hey.
Matt, if you guys saw this one, but this is my cousin Matt, and I found an old picture of us way back. I think it's just so cool, and we were trying to figure out
who
who
took the picture?
picture. But Matt and I are going to flip, and we're just going to put our name down there as if we were using a tripod
Yeah.
for photo credit.
Hey,
Andrea,
Pat,
do you want the photo credit on this one?
Gosh, you're unbelievable. Come on, man.
But
Let's try to be somewhat informative. Let's go to T cells. There's been some great information on T cells in the last 2 days. T cells and cancer. Just
And
Google T cells. T cells.
Okay.
Because if
Dude, I just love how you just think that everything just magical. You can just talk about it and then it's
Well, I
come
mean,
up there.
how
I
many
want a
letters are we
secretary.
talking about? 6 of them?
T cells and B cells. What do you want? T cells and what? Cancer?
Oh my! What do you think I said? I wanted T cells. T.
Yeah, but I'm saying what kind? T cells, cancer?
Yeah, sure. Yeah.
Okay.
Sounds good.
You know.
Just see what comes up. Like from Business Week, like USA Today, like anything current.
Scholarly articles. Will that mean?
Oh, how about the second one? How about the second one from the? Is that say the Scientist? Science Alert. You guys want to check this out for yourself, but there's probably about 300 articles on the same thing.
See it?
T cells. There's a word extraordinary in the first sentence. All right, yeah, whatever. They can play this back.
Now,
Just
do you see
Google it at home.
I got it right here. Do you want that? Go ahead.
Well, yeah, I was trying to read it.
All right.
International team of researcher has seen extraordinary results using patients' own immune cells to fight cancer. In one trial, 94% of patients with acute lymphoblastic leukemia saw their symptoms disappear entirely. What? So this goes under the arm, when we're talking about regenerative medicine, of stem cell. So there's cell therapies that are out there that are, do me a favor, get off of this one. Go stem
Hold
cells
on, Louis,
and
I know, but I'd like to give shout outs. I got Megan McMullen, Felicity, and my boy Louis Costa. Louis! That's my boy. Louis Costa. That's a book spin, man. Come on, Louis.
That's nice.
Guy. That's it. Louis Costa. Okay. What were we talking about? T cells.
yeah, we're on to the next thing. Type in stem cells and we'll say macular, MACULAR.
Degeneration. Gotcha.
Yeah.
Okay. Which one do you want? The first one?
I
Embryonic?
don't know, yeah, click the first one you see. Whatever.
now-
Click the first one.
It's really, I know who we can get
Lancet.
into. I know it.
I heard of that one. That's a good one, right?
Well, I know a
Boom.
girl.
What's the preliminary?
I know a woman that does all this stuff, and we'll get
What's
her.
the date? 2012. This is old as you are, older. Yeah.
Man, vicious tonight. What did you eat before? It was like red meat or something. You're coming after me.
I had a ham and cheese sandwich with spicy
Retinal
brown mustard
degeneration?
on a potato roll.
Retinal degeneration.
Get out of here. You're in scholarly articles are always messed up. Just go back, get out it, go back to like general search. I'm just telling
Here,
you
what would you like?
that they're using
I'm following
stem
your
cells.
lead. What do you want?
Here it is. One stealth treatment. Go down to that one. Yeah, when's the date on that? I can't see it.
We got
17. That's a recent one.
2017.
Yeah, that's the one I want.
We got Mikey Gosselin in the house. What's up, Mikey? Another soccer player from down University of South Carolina. Baby.
All right, soccer player. One stem cell treatment stabilizes macular degeneration and other blinds 3 patients. I guess they're saying that it's not. It's a little bit of like, hit and miss right now on that article.
What, you want to go to something different?
I've read at least.
CNN,
I'm not afraid of fake news or whatever. Let's see. As we grow older, a common disease called macular degeneration threatens. However, serious concerns about treatment. So there's a bunch of people with stem therapy right now that are like, be careful, be careful, be careful, be careful. That's one. And then, hold on a second. I like that. New England Journal of Medicine. That's a good one. As we grow older, you scrolled up just as I was reading it.
Oh, I'm
It's like you
sorry.
got such bad timing. It's like ridiculous.
Hey,
All right.
don't my cousin's eyes look real nice? His blue eyes with the blue shirt, just setting the eyes off. Little, very nice, man.
Yeah, so
Looking
if I
good.
get macular degeneration, there was a study published Wednesday in the New England Journal of Medicine. I mean, that's a pretty good publication, isn't it? And what it found, it's the first treatment using personalized genetic identical cells derived from the patient. It proved affecting and halting the disease. This is the iPSC cells that we were talking about earlier from the own patient. The guy won the Nobel Prize for the iPSC cells. They can take them from your own skin or fat and make them into any cell that exists in your body. Eye cells, nose hair cells, whatever
I don't
cell.
need any more of those nose. I don't need any nose hair cells.
Yeah,
Get
whatever.
that straight right now.
They do have. They were. They just. I
I
did
want
read
to
an
know
article
if,
the other day where
as
they.
you get older, do more nose hair cells start to pop up, or what?
I guess so, and ear hair, too.
Man, you know, I see Mark Root, another soccer player from South Carolina. He's on.
All right,
Mark,
minimize the screen. Minimize the screen. Those are just 2 stem cell stories, and there's many out there. Search them out yourself.
yeah. So I was hoping to maybe get Mark on here. You know, I basically, we went to business school together, and he helped me through college. He was one of those smart guys, and
You cheated?
He developed my eyesight. I mean, my eyesight used to be great just because I had to like
Look at his notes. You had to look at Mark's notes? Yeah. That's funny.
So Mark, or you know, like put the answers behind, you know, in the bathroom behind the toilet. I'll get them. Okay, cool.
Creepy.
Yeah. Hey, you know what it is? It's all about getting through and figuring out how to get it done. See, HTTP colon here.in. What happened? Cat got your tongue?
You're driving.
No, but I'm typing over here. I'm trying to. Eula, Salvador, and from Philippines.
All right, I'm ready to do a recap. We've been on this for a long time.
Yeah.
Okay. So the recap is we're going to have this recorded, and it's going to be able to be searched as the Matt and Pat Show on YouTube. And so you can play it back for any of the information that we put on there. In addition, very soon we're going to have one of these, and we can fit up to 12 people on these panes. Is that right? 12, Pat?
12.
Okay, we're going to put up to 12. We're going to have a bunch of people that are scientists from around the globe that are going to be talking about regenerative medicine. Today was just like a little appetite teaser. Take a look at stem cells, take a look at CRISPR-Cas9, take a look at bioprinting. Those are the 3 pillars of regenerative medicine, in my opinion. There's other therapies that are out there. So we're going to bring the scientists in and facilitate a conversation to educate everybody on what's going on and what's next in science.
Hey, Wes, take care. We'll see you, brother. Brush your hair. Yeah, so this is just a little prelude into what's gonna happen next with this group of people that are leading the way in science, and we are going to gather these minds, and we are going to. Matt is probably going to, since he's probably a little bit more informed about this science stuff than I am. Okay, I said it, bro. Yeah, so, but I will be here because someone's got to control the switchboard until we get a secretary. So.
You're doing a great job, man.
And I'm looking forward to it. I will also be doing, and if my cousin wants to join that, I'm going to be doing a crypto podcast really soon as well, because this digital cash stuff is really taking off.
It is taking off. I've got friends that are in it, and they are making a great amount of money on their investments. I'm not in it. I'm
let's say I got into Ether about a year ago at $6, and today it was up above 400. So that's the kind of money that can be made in there, but I should have bought a lot more than I did.
Hindsight's 2020, Pat, even with glasses.
But there's some really cool things to know about that. And on the publishing side of blockchain with Steam and a whole bunch of things like that that I think are cutting edge and really cool. And you might as well be ahead of the curve before the curve comes around and knocks you in the head.
Great way to end it. That's great. All right.
Okay, so everybody, thanks a lot for coming in. I really appreciate it. That's Matt over there. And I'm Pat. You guys have a great night. Enjoy. Peace.